Hi, my name's Suzanne. I'm the nurse here at Pacific Center for Plastic Surgery. I'm going to talk to you today about the post-operative instructions for liposuction. We're first going to talk about your activity. When you go home today, you're going to rest. And it's important every couple of hours that you wiggle your toes. You don't need to wake up in the middle of the night and get up and walk around, but we do want you during the daytime hours to get up and move and wiggle your toes and keep that blood circulating. If you have TED hose on, you need to keep those on your feet too for about 14 days after your surgery. Also, it's important to remember that you can't do any heavy lifting or bending. There's no sexual activity for 2 weeks after your procedure, and you also need to not drink alcohol or smoke during the next 2 weeks. Let's talk about your position after your recovery from your liposuction. Whatever area that you had liposuction on, you need to keep it elevated. If your extremities, if you have liposuction, you need to keep them elevated on pillows. If you had liposuction in your legs, you need to try and keep them elevated. An important point to remember is any area that you've had liposuction on, there's going to be drainage. Regarding the drainage, you can use a couple things to protect your furniture or your bedding. A couple tips: you could use a big plastic bag and lay a sheet over it so you don't drain on the mattress or on your couch. But please be aware during that first week that your body is going to have some drainage and you need to protect your furniture. It's important anytime you have surgery, especially with liposuction, that you keep those areas elevated. Let's talk about ice packs. Ice packs are something that you can use 20 minutes on, 20 minutes off to the affected area. Something that's really helpful is to use frozen peas. I suggest that you buy a couple bags of frozen peas and then you can rotate them through the freezer and just apply it to the area that you have had your surgery. Your diet after liposuction is a little bit different than typical surgery. You will be instructed to purchase Gatorade or some kind of fluid and electrolytes to have after your surgery. Because there is a fluid and electrolyte shift, you need to make sure that you drink more Gatorade or whatever product that you want to have than water for the first week after surgery. It's also important to have protein. Protein promotes your body to heal. And another thing to remember, during your recovery time from liposuction, you may tend to have a lot of itching. Benadryl is a really helpful medication to use after your recovery to help with the itching from your recovery time. Wound care after your liposuction. After 3 days of your surgery, you can remove the garment. If there's any tapes in place, please leave them there. If the tapes come off, you can clean them with a little hydrogen peroxide and bacitracin. Some of you are going to have foam on certain areas that you've had liposuction. This 3rd day is when you're going to gently peel the foam off and remove it. At this time, you can throw your garment in the washing machine, but don't put it in the dryer because it will shrink. You can let it drip dry for a couple hours and then put the garment back on. This garment needs to be worn up to 6 weeks after your surgery. Something that is really important that you need to remember about your garment is that it needs to stay smooth. If you're wearing your garment on your body because you've had liposuction in the abdominal area, you need to make sure that when you sit down and you stand up that you straighten out any wrinkles that could be in that area. If a wrinkle happens, it can actually cause abnormal swelling in that area, or it can cause a crease. And you want your liposuction to heal nice and smooth. So that's why it's really important that you keep your garment properly placed on your body. During your post-operative time, you're going to be taking pain medication. We don't want you driving while you're taking any pain medication because this does inhibit your ability to make good decisions. Let's talk about some of the common medications after surgery. And you'll start taking your antibiotics when you get home, and you'll take the remainder to the following day, in the morning and then in the evening. Next, we'll talk about your pain medication. This could be Norco, it could be Ultram, it could be Celebrex. It's important to take your pain medication as directed by the doctor, especially in the first 24-48 hours. After that, you can take the pain medication as needed. A common side effect to taking pain medication is constipation. That's why on your list of medications, we recommend that you purchase Colace. Colace is a natural stool softener that just helps soften that because the Norco tends to cause constipation. Also, general anesthesia can kind of slow things down. So it's important if you already have an issue of constipation to take Colace on a regular basis so that you have regular bowel movements. Some other medications could be a clonidine patch, a scopolamine patch, and within those two patches, the clonidine is for blood pressure, and that's something that you would leave on for 5 days after your surgery. And another patch, which is the scopolamine, stays on for 3 days after your surgery, and that helps with nausea. When you do take that nausea patch off, please remember to wash your hands after you take that patch, because if you accidentally rub your eyes, you'll have blurry vision for up to 24 hours. Another common medication that we prescribe for you is Zofran, and Zofran is an anti-nausea medication. And that you can take every 12 hours, and that helps with, some people have an upset stomach to pain medication, some have an issue with anesthesia, but it does help kind of settle your tummy down. It's also important to eat some crackers or have some toast or something before you take your medications. We talked a little bit about what to expect after your liposuction. We talked about drinking Gatorade. You're going to drink that for about the first week until your first post-op appointment. You may feel a little dizzy and lightheaded, and you also may feel a little itchy. This is all very normal in the healing process. It's also normal to have bruising and swelling, and this can take up to 6 weeks for this to start to go down. If you get a fever 100.4 or above, you need to call the office. Also, which is very uncommon, you can watch for excessive bleeding or swelling. Anytime you have concern, please call the office and our staff will be happy to help you and ease your mind to let you know if there's any problems that you need to be concerned about.